HIV prevention funding could be one of the next targets for the Trump administration's cuts. Dr. Céline Gounder is here with me in Studio 57. She's a CBS News medical contributor and the editor-at-large for public health at KFF. Good morning, Dr. Gounder. Great to have you back with us. What precisely might be cut as part of this?
HIV prevention programs in particular are under threat. And what's really interesting about that is under Trump's first administration, his administration established a plan to eliminate HIV in this country, meaning that we would stop transmission of HIV within the country. We have new tools that are available. There's a medication that's going to be, we think, approved in June by the FDA. That would be a twice-yearly shot to prevent HIV. So imagine you just stop by your doctor's office twice a year, you get the shot. It protects you from HIV. And that very medication, we think, may actually be good for that purpose once yearly. And so now that we have these game-changing tools, it really is confusing that now would be the time that you would want to pull back on these goals to prevent HIV.
I want to put into better context what you've just laid out there, what Trump promised or pledged during his 2019 State of the Union address, in fact. Let's just listen to that.
My budget will ask Democrats and Republicans to make the needed commitment to eliminate the HIV epidemic in the United States within 10 years. Together, we will defeat AIDS in America and beyond.
So with that commitment, with the twice annual shot that you've just mentioned, why make these cuts now?
This is part of a larger restructuring of HHS as well as the CDC. What I'm hearing from CDC sources on the inside is that the cuts are shifting literally minute to minute how this is going to play out. But ballpark, they're looking at probably 1 in 3 people at the CDC being let go. And I think one other thing people really need to understand about the CDC is it functions as a massive funnel of funding from the national level down to state and local health departments. And so very often these state and local health departments will contract with others to actually provide services. It could be community organizations, it could be healthcare providers. And so this is going to have massive impacts for HIV and other public health programs across the country.
And as you just allude to, it's not just HIV prevention, because there are these grant cuts at the National Institutes of Health as well. Give us an idea of what programs that will hit.
Well, we're still waiting to see how all of that's going to play out.
Yeah.
The National Institutes of Health, their total budget is $48.6 billion. And we're looking at billions of dollars likely being cut. Based on what's been announced so far, it's already in that ballpark. Columbia is looking at a $400 million loss in funding so far. Johns Hopkins has so far taken $800 million in cuts, and there's more expected to be coming down. And these are grants that are funding everything from cancer to Alzheimer's disease to autism to various chronic diseases to HIV. And so this is really not, no part of medicine, no part of research is going to come out of this unscathed.
Yeah, and this impacts all of us. So I really appreciate your insight on something that we need to keep watching closely. Dr. Gounder, thank you.